Hello and welcome to Futurology, a programme from the British Association of Urological Surgeons and ITN Productions. In the 21st century, the field of urology has become a centre for pioneering surgical techniques, taking minimally invasive surgery to new levels. But with hospital referrals for urological problems steadily increasing, what more can be done to help patients and the medical practitioners who treat them? I'm joined now by Tim O'Brien, President of the British Association of Urological Surgeons. Tim, welcome. Now, I know BAUS is celebrating its 75th anniversary this year. How far has the sector come in that time?
I think the speciality is unrecognisable from 75 years ago. I think actually it's unrecognisable from 25 years ago. The march of technology, new drugs, new treatments, endoscopies, safer surgery, I think it's just unrecognisable. Really, there have been some huge successes. One of the biggest oncological successes is a urological success, the treatment of men with testis cancer, previously untreatable, and now most men survive. Not everything's changed. I have here in my hand a journal from 1945 when BAUS was formed, and urologists were debating in that journal how to treat the prostate surgically, and urologists continue to debate how to treat the prostate surgically. So most things have changed, but not everything has changed.
Now, you touched there on new technology. Tell us a bit more about how that's supported surgeons and, of course, benefited patients.
Well, I think it's the switch to minimal access, isn't it? The advent of fiber optics, telescopes, laparoscopy, keyhole surgery, robotics, imaging. The revolution in imaging is absolutely extraordinary. And I think that means that there's less guesswork and everything is more precise. And that's got to be good for patients. It's much safer.
When it comes to medical students deciding which path they should follow, why do you feel that this is a particularly good path for them?
I think there's two main reasons, really. One is that the incredible breadth of our specialty. This isn't a speciality that fences you in. There are 6 cancers, the stones, the prostate, sexual dysfunction, infertility. There's room for everyone in our specialty, and I think anyone who chooses it can find a home there. I think the other reason to choose it is actually generally urologists get along with each other. I think they know how to work, but I think they also know how to relax.
How is BAUS supporting this sector in all these areas?
Well, our role is to educate, develop and support urologists. And we do that by bringing urologists together to share ideas and techniques. We're reaching out to students. We want them to consider urology as a career. We don't want them to write off surgery as a career because of preconceptions or misconceptions. And we're sponsoring the best quality research. The way the speciality moves forward is through research, and we want to be at the heart of that.
That's great. Tim O'Brien, thank you for joining us.
Thank you.
One quarter of all surgical referrals to hospital are for urological conditions, with urology making up 1/10 of GP consultations. With the number of urological referrals increasing, Robin Ross went to find out why there's never been a better time for medical students to think about urology as a specialty.
Sotane has just been appointed as a consultant urological surgeon at Salford Royal Foundation Trust and is due to start early next year.
So you can do robotic surgery, you can do laparoscopic surgery, so keyhole surgery, you can do open cancer surgery, you can do benign operations, you can do endoscopic surgery, stone surgery, you can do reconstructive surgery. So there's a whole host of different disciplines in one particular specialty.
Urology is not a prominent part of medical students' training. The British Association of Urological Surgeons wants to raise its profile. BAUS President Tim O'Brien has enjoyed a long, varied career, mainly specialising in kidney cancer. But urology was not the obvious choice.
I knew I didn't want to do urology. That was the one thing I knew, and here I am 20 years later as a urologist. I think it was only when I was exposed to the speciality that I realised what it had to offer. In our organisation, yes, 40% of the cancer diagnostics is done by urologists. It's astonishing, really, nearly half.
This is Magana Kulkarni, a urology registrar and currently a clinical research fellow. A 6-month urology attachment made up her mind.
There was something about surgery and urology that was just very attractive. It's a really fast-paced specialty. You have a mix of pathology, a mix of patients. So children, adults, men, women, people that are quite well but have a big impact on their quality of life, people that are really sick. And that was just very interesting.
Jo Creswell is Vice President of BOUS and a consultant urological surgeon and cancer specialist at James Cook University Hospital in Middlesbrough.
What would be the one thing that you would say that would make somebody think, oh yeah, that's for me?
Urology is simply the best specialty in the world. At least spend a few days in urology before you dismiss it, because otherwise you're going to miss out on a real opportunity.
Specialist surgery is still male-dominated, just 10% are women. But there is hope. In surgical urology, 40% of trainees are female. Jo will become the first female president of BOUS in 2022.
People have said to me, for example, if you look 5 years ahead and you don't see somebody who looks like you might turn away. So if having a female president, if it being me, from the north of England, a jobbing urologist helps, then that's all the better as far as I'm concerned.
The beginning, middle and end of your career is ever-changing. Sutonier is chair of the BOUS section of trainees.
And one thing I found that was really interesting at the start was that I was allowed to do quite a lot of operations at an early stage. There were some simple operations that I can get involved in, and there were some simple operations that I could actually perform.
Meg's PhD is looking at scans for patients with prostate cancer.
I would love to do a job that allowed me to do some clinical work in cancer, but also to teach and also to do some research. And it's very much possible in urology. So it's giving me everything I want and hopefully the right thing for patients as well.
So at the beginning of the week, I might be doing major robotic pelvic surgery, but later on in the week, I might be doing outpatient diagnostic work. And it also gives me the opportunity during my career to flex how I want to work and move into perhaps a different part of the specialty if I don't want to be involved in the major operating.
These specialist urology registrars are at the start of their careers.
We deal with the whole urinary tract from the kidney to the exit of urine. So there are a lot of different areas of the body we deal with different and often challenging anatomy.
I was inspired by the people in the specialty. I felt urologists were humble, genuinely nice and friendly people with a welcoming attitude.
The macho world of surgery does not exist in urology.
When I looked around my senior urology colleagues, they all looked to be very relaxed. They're nice people having a nice time. And I think that's because there's relatively few urological emergencies in comparison to other surgical specialties. And that actually offers for a very nice work-life balance, even as a registrar or as a consultant.
Urology has been at the forefront of technology, from keyhole surgery to robotics, and is expected to continue to push the boundaries.
I think my own career has, taken on new things as I've dropped certain things and taken on things. And I think that just adds to a more satisfying career.
Interstitial cystitis, also known as painful bladder syndrome, is a debilitating condition that can affect both women and men. An innovative market-leading treatment distributed by Aspire Pharma, which can be self-administered at home, helps to restore and protect the bladder lining, relieving the symptoms and reducing the suffering of the patient. Sharon Thomas reports.
You've had the bladder treatments, you've completed that course. Going forward, if we could, it would be good to teach you to do it yourself. You've seen the syringe, it's very straightforward.
Kath Walker has suffered with bladder problems for nearly 30 years. It's been utterly miserable.
Awful, really, really awful, that I couldn't go anywhere. I couldn't plan very much, because of the situation with my bladder.
During the pandemic, with so many clinics closed, most consultations were on the phone. Kath's consultant introduced her to a product called Ialuril, which helps repair and replenish the damaged layer of the bladder lining. And she can now learn to self-administer, should she choose to. Until now, she's been managing on antibiotics alone.
I'm pain-free and no backache, no bladder pain, and no rushing over to my GP for antibiotics and things. And, I can plan my social life far better and not having to revert around my bladder situation. Changed my life, absolutely, yes.
We're now going to look at administration of Ialuril using the adapter.
Ialuril is used for the treatment and management of recurrent urinary tract infections, chemical or radiation-induced cystitis and interstitial cystitis. Interstitial cystitis, or painful bladder syndrome, that causes debilitating long-term pelvic pain with increased urgency and frequency of urination. During lockdown, patients were taught how to administer Ialuril themselves via nurse-led online videos. Steve Foley is a Reading-based urologist. His clinic has been carrying out bladder installations for more than a decade.
During the time that COVID's created this need to treat more patients in the community, we've been able to accelerate what we were already doing. We're teaching patients to do their own Ialuril treatments at home, a course of 6 initially, going on to a monthly, and by being able to do it themselves, they're able to take control, they're able to feel like they're in control of their own bodies and their own condition.
Patients like Kath have been left with little option during COVID. Aspire worked with clinicians who clearly wanted to focus on the immediate needs of their patients. This meant the management of chronic conditions like Kath's could be managed in the community or at home rather than in hospital, while specialist staff still have oversight of their patients. Aspire is a specialty pharma company which offers a range of products across many therapeutic areas. Like so many others, the Hampshire-based firm had to adapt quickly when COVID hit hard. So, as part of the evolution of Ialuril, they worked with community partners to introduce an adapter so patients could self-administer at home without the need for a catheter.
COVID has been a really turbulent time, not least of all for the patients. And at Aspire, we're focused on the patient welfare and their well-being to increase their quality of life through the products that we actually deliver. We've spoken to the nurses, we've spoken to the clinicians, and through the introduction of the Ialuril adapter, we've allowed this quality of life to be improved by treatment of patients at home.
Aspire worked closely with patient groups, many of whose members have the condition, to introduce this new innovation, making the class-leading Ialuril the only treatment that can be instilled directly into the bladder without a catheter. Tell us a bit about your condition and what sort of a difference it's made for you, the fact that you can now self-administer.
It's difficult living with the condition. It's a very challenging condition. It requires some flexibility. Being able to self-administer an installation at home gives that flexibility and means that you can do it at a time when it's convenient for you.
Aspire hopes that highlighting to clinicians and patients how successful this shift to community management of these conditions has been during the pandemic may continue to help relieve pressure on an already overstretched NHS in the future.
It's given me my life back, my social life. You know, I'm living again, properly.
Clinical nurse specialists add huge value to urology departments across the country. However, effective succession planning for these roles is essential to maintain and develop future services. The Royal Wolverhampton NHS Trust believes that by focusing on forging rewarding careers for nurses, patients receive better outcomes in their long-term treatment plans. Selina Downs went to find out more.
At Wolverhampton's New Cross Hospital, urological surgeon Peter Cook and his team are performing a robotic prostatectomy.
Slowly, 2 more inches.
It is fascinating to watch.
And stop.
Several small incisions are made in the patient's abdomen, then instruments are inserted and attached to robotic arms. With the utmost precision, the surgeon controls the robot, sitting at a console with enhanced 3D vision. While at the operating table, a specialist urological nurse is performing equally critical work that the surgeon says is vital.
They set up the patient. During the course of the procedure, they will bring in sutures, they will bring in clips, they will suck. They are my hands and ears in the operating theatre, and you can't do this kind of surgery without a dedicated assistant.
The robotic surgery is only half the work.
Afternoon, Mrs. Beasley.
Patients need to be supported both before and after surgery, and this is stimulating new opportunities for urology nurses to enhance their own careers.
You having any issues at the moment? Any bleeding?
Yeah.
Jenny Akins has been a nurse for 21 years. In that time, she's completed a degree and a master's and has advanced her career to that of autonomous practitioner.
Generally, it's prostate and bladder cancer I deal with. I see patients from the GP, so I assess, make a diagnosis, initiate treatments, request investigations, and I'm able to prescribe. So I'm preventing any delays in that patient's journey. I have been very fortunate to be supported, and not by just the trust, but clinicians, by my managers, and they have encouraged me throughout my education, my development, which has enabled me to progress up to an advanced nurse practitioner.
And with ever-increasing demands on clinical nurse specialists, the British Association of Urological Nurses is there to provide support, education and development for the urology nurses of the future.
I think that if you're going to develop from a novice to expert in terms of being a specialist nurse, then you ultimately have to marry that up with educational structure. And most advanced nurse practitioners are degree level or master's level trained, and that gives you the insight to not just look at giving protocol-based care, but to actually look outside of that and to respond to unique situations.
Specialist nurses play a vital role in relieving some of the burden on clinical teams. Their education and experience is invaluable both to the hospitals they work with and the patients they care for.
It's the most exciting, stimulating area to work as a nurse. It offers immense opportunity for development of both your skills and your knowledge, and you can make a huge impact on the patient experience, which is ultimately the most rewarding.
Hello Robert, my name's Mandy.
Improving the patient experience is just one of the many challenges.
The purpose of this video chat is to go through everything about your surgery, so have a chat about what's going to happen before your operation and on the day that you're here and on the day of discharge.
The patient chats have moved online due to COVID-19, but they are no less comprehensive.
So Robert, this is where we're now going to talk about your catheter.
Designed to help put cancer patients more at ease before, during and after their treatment.
Junior Hemans.
Junior Hemans is just one of the many patients who say they've received first-rate care and support from the urology nurses at New Cross.
You can talk to them about anything and it's not deemed uncomfortable in terms of having that conversation because of their professionalism.
And it's that professionalism that aims to promote and maintain the highest standards of urological nursing and patient care now and for the future.
There are many people who suffer in silence with bladder problems. Bladder Health UK is a national charity that offers help and support to people who contact them. Often the need is just wanting someone to talk to and open up about their problems. Sometimes it's to share experiences and to find out more about treatment that can improve their quality of life.
Well, there's an awful lot of people that suffer with bladder problems in the UK. Some will say 14 million people have some sort of bladder problem. And these people, they can get medical treatment, but sometimes it's an emotional impact that has a bigger impact on their lives than the medical condition itself. Having a bladder illness won't kill you. And that's the difference between having a cancer or a heart condition. So lots of people are left to deal with it on their own because in general, that's what we've always done. But we at the charity, because we run the advice line, we've got the Facebook pages, we know just about the impact that it has on people's quality of life, their work, their relationships, they're going on holiday, all of these kind of things are impacted.
So I suffer from interstitial cystitis, bladder pain syndrome, have done for 25 years now. It was very hard at first being diagnosed as a young sufferer. I wasn't able to work. wasn't able to lead a normal life and quite often was not even able to leave the house. And I felt there was nobody who understood, empathised, nobody else in the world who felt as I did. And then when I joined this charity, it was a complete revelation to me to find out, hey, actually there are loads of people out there who have the same condition.
What can people expect when they contact you?
We listen, and I think that's something that a lot of medical practitioners don't have time to do. So if we get called to the advice line, sometimes it can be 10 minutes, sometimes it can be nearly an hour.
So we have a closed page on social media which operates 24/7 for sufferers of IC, painful bladder syndrome. And one of the sufferers at 11 o'clock at night, she had a suprapubic catheter and was having awful problems getting it to drain and to connect the night bag to the stand. And fortunately, one of our moderators on the page was available at 11 o'clock at night and talked her through it via FaceTime, which meant that she was able to sort that out and didn't have to go to A&E.
There's a lot of alternative treatments out there that we know about within the charity. And although we're not a medical body, we have medical help from a medical panel and specialist continence nurses, but we can put people on a path they hadn't thought about before. We've got things like shared decision making, so patients are involved more in their treatment options before they make a decision. And there's also patient-reported outcome measures, which is a target measure now that's been introduced. That, again, is about surveying patients post-operation, post-surgery, to see if their outcome is what they expected. And I think some of the surveys have shown that it's not been the case, and that can change practice. And that in itself is another measure which is designed to improve quality of life for the patients.
How important has sponsorship been to the charity, particularly during the pandemic?
So we had a lot of contact from members who were saying they were really struggling, clinics were closing and their symptoms were coming back because they weren't able to continue with their regular installations. I then contacted our corporate partners to ask if there was anything that could be done to help during this time. And they were extremely helpful in providing installations directly to our members, and also some fabulous information on how to self-instill at home.
What drives you to do the work you do?
Well, I think it's because you make a difference. An awful lot of people out there haven't got any help. They daren't talk to their families. They're ashamed of being incontinent. The stigma that's attached to it is something that they find really difficult to deal with. But if we can get somebody to become aware of Bladder Health UK, give us a call on the advice line and we can help that person to have a better quality of life. We've made a difference to that person.
So it goes without saying this charity is invaluable.
It's everything to me, absolutely, yes. Yeah, being able to offer that support and to give back what was given to me, yeah.
Thank you for watching Futurology. All our interviews and reports are available on the British Association of Urological Surgeons website and the ITN Productions Hub. The details are on screen now. From me and the team here, thank you for watching and goodbye.